Good afternoon. My name is Charmaine Anderson, Director of Advocacy for Allergy and Asthma Network. Welcome to our Allergy and Asthma Day Capitol Hill Brief webcast. In response to the ongoing COVID-19 pandemic, this webcast, along with other advocacy activities, are being conducted virtually for 2020 instead of in person as part of our day-long Allergy and Asthma Day Capitol Hill event, also known as AADCH. To participate in the advocacy activities, which includes sending letters and making phone calls to your members of Congress and posting to social media, please visit our event website at www.aadch.org for more information. I would like to acknowledge the American College of Allergy, Asthma, and Immunology and our other sponsors and say thank you for their continued support. We have close to 300 attendees participating in this webcast and many more taking part in our virtual advocacy activities. We appreciate your willingness to participate in the varying ways as we must remain diligent in raising awareness of issues that impact Americans living with allergies, asthma, and related conditions, and engage policymakers to move our message forward. I am honored to work alongside a team of dedicated individuals who are driven to their core to move the network's mission forward in areas of education, outreach, advocacy, and research. And the leader of this great team is our President and CEO, Tanya Winters, who will facilitate this webcast and who you will hear from next. Thank you and have a fabulous day.
Good afternoon, everyone. Thank you, Charmaine. As she introduced me, I am Tanya Winters, the President and CEO of Allergy and Asthma Network, and it's my distinct pleasure to welcome you to the 23rd Annual Allergy Asthma Day on Capitol Hill. For 23 consecutive years, Allergy and Asthma Network has remained focused on the same mission, and it is our honor to continue to offer the Allergy and Asthma Day on Capitol Hill as part of that mission that we will outline in just a moment. I would also like to thank those of you who are participating today and our sponsors, because without their support and help, certainly this event would not be made possible. As I mentioned, since 1985, Allergy and Asthma Network has been dedicated to the same mission: ending needless death and suffering due to asthma, allergies, and related conditions. We do that through our 4 mission areas of outreach, education, advocacy, and research. And Allergy and Asthma Day on Capitol Hill is the premier event of our advocacy efforts throughout the year. We recognize that, again, there are over 50 million Americans that are directly impacted by these conditions. And that is why we advocate. That is why we are here today. You're going to hear from leaders and experts in the field around why we advocate. But I want us to remember that today, on this Allergy and Asthma Day of Capitol Hill 2020, which is unlike any other that we've ever held, unfortunately, 12 Americans will die due to these conditions. We can't just say this is simply asthma, or it's just allergies, or just eczema, or, well, of course, people with COPD are going to die. No, these are conditions that are driving comorbidity of COVID, but also its own morbidity and mortality each and every day. And that is reflected here in the number of 12, which are the number that die daily here in America due to allergies, asthma, and related conditions. So again, we want to start out by talking about, since we were together a year ago today, or a year ago in Washington, D.C. live for our Allergy and Asthma Day on Capitol Hill, how has the year evolved? Again, we know that health advocacy is essential to protect patient health and safety, and advocates play a crucial role in raising awareness, educating policymakers, and educating the general public. We work to remove barriers and make issues widely known in order to make medical care and treatment more accessible and effective. Healthcare challenges need thoughtful solutions to support patients, their families, and communities. And it's by engaging stakeholders like you and key constituents that is important to advance this effort. Each year, the network actively engages in advocacy at the federal and state level. And again, we work to raise the visibility and influence policy to improve care and promote life-saving research for millions of people affected by allergies, asthma, and related conditions. In this 2020 year, as the world faces the global pandemic of COVID-19, it is more important than ever that people have access to affordable care, and we want to thank you in advance for your efforts on this Allergy Asthma Day on Capitol Hill. In 2019, our advocacy efforts aligned with our policy priorities, which you'll hear more about throughout the course of this briefing, but we want to highlight some of the key efforts that certainly we are very proud of. First and foremost, we advocated for federal policies, programs, and regulations to support patients and their families. We had increased federal funding in the fiscal year of 2020 to all of the agencies that are listed here. We also helped to advance the school-based allergies and asthma management program. This is a legislative effort in the House of Representatives that currently has 45 co-sponsors and helps to ensure that there are consistent efforts in managing asthma and allergy in schools. Also, we've worked at the federal level to advance the Safe Step Act, HR 2279. This is an effort that has gained great traction, ensuring that we can get the right treatment to the right patient at the right time. And this bill in the House of Representatives currently has 137 co-sponsors. So again, the Safe Step Act requires that health plans provide exceptions for medications that are subject to that step therapy protocol. And we are so grateful for so many of our partners that are on the call today in helping us to advance these important legislative efforts. On the regulatory side, we have provided testimonies in the last year at FDA, including that resulted in obtaining a black box warning on montelukast and addressing the safety issues specific to that drug. We also have included testimonies at EPA and CMS on very important topics around climate change and mitigating environmental hazards. We also have worked to advance state legislative policies. We've had actually over 20 states that are now introducing stock albuterol and covering stock albuterol at the state levels for schools, as well as step therapy and prior authorization legislation. We have provided testimonies of patients, experts, letters, calls, emails. All of this has absolutely worked to advance state legislative policy to protect patients and ensure, again, that access to care and access to treatment. And then finally, in this year and in the most recent days, we've been very active in relation to the COVID relief packages and the passage of the CARES Act. We've literally weighed in on over hundreds of different letters and sign-on opportunities to let your voice be heard as the voice of patients and families living with allergies, asthma, and related conditions. So what about our 2020 policies and policy priorities? And what about what we are asking you to do today to engage your federal decision makers, to connect with your members of Congress on these specific issues? First, it's access to care. Access to high quality, affordable health care and insurance coverage is essential to achieve the most successful health outcomes for patients. This adequate coverage for patients ensures that they can rely on government programs like Medicare and Medicaid, which are becoming even more important and taxed given the unemployment rates due to COVID-19. Furthermore, we want to ensure access to innovative therapies and technologies, including biologic medications, immunotherapy, telehealth, and remote patient monitoring. These, again, are vitally important to address the medical needs and improve patient lives. We're going to go through each of these policy priorities and hit some of the highlights of the specific activities associated with them at this time. So again, you can see access to care, affordable medication and treatment, asthma and allergy program funding, health equity, food package labeling, airline passenger safety, and coronavirus COVID-19 relief as our key advocacy issues for ADCH 2020. Again, in the access to care area, it's things like adequate coverage for people that are living and relying on Medicare and Medicaid, definitely those with pre-existing conditions, and of course, as we've already mentioned, school-based health management programs specific to allergy and asthma. It's also addressing step therapy and continuing to address the access to telemedicine technologies to truly improve and provide respiratory care services. Secondly, affordable medications and treatments. Again, we know that there are very high prescription drug costs for many patients, and those out-of-pocket costs definitely impact access to care and access to treatment. So we want to continue to reduce those out-of-pocket costs by legislative and regulatory efforts, and also by working with our industry partners to ensure transparent, fair pricing. We also want to improve access to generics and biosimilars in the Part D Medicare program and have provided a number of comments respective in that way, as well as providing a separate HCPCS billing code and reimbursement in Medicare Part B for biosimilar products. In the federal funding of the areas of asthma and allergy, you can see that we are continuing to advocate for appropriations in fiscal year 2020 and as the discussions ensue for 2021 around continued asthma and allergy research and outreach initiatives for the U.S. Health and Human Services, including CDC, NIH, and HRSA, as well as HUD, DOD, and the EPA. One of the key aspects and elements that are most near and dear to Allergy and Asthma Network is around health equity. We know that the development of health equity interventions are needed to support better health outcomes for all patients. In this day of COVID-19, health disparities and social determinants of health have taken center stage, and we know that cross-ethnic and socioeconomic groups that it's impacting individual health and well-being more drastically. Asthma and allergy rates are higher in poor urban areas and more common in African American and Hispanic children, according to the CDC and the National Center for Health Statistics. So we need these proven intervention strategies to develop successful health equity interventions. We also are working to advance food package labeling in collaboration with other patient advocacy organizations to serve the nearly 30 million Americans that are currently living with food allergies. We know that sesame allergy has increased in recent years, and therefore we need to advance the labeling. The Food Allergen Label and Consumer Protection Act of 2004 to ensure that it reflects sesame as a major food allergy as well. In the airline passenger safety area, it's all around the inclusion of certain medications in the emergency medical kits. Again, as the more than 50 million Americans living with these conditions continue to travel and re-engage in travel, we know that we want to ensure that they are protected. And so therefore we are advocating for no fewer than 2 packages of epinephrine autoinjectors, and also ensuring appropriate training for those that are working in the airline industry on recognizing allergy and asthma symptoms when in flight. And then finally, enforcing greater restrictions on animals aboard passenger flights, and certainly addressing the needs for greater airline passenger safety in light of COVID. So finally, when we look at the COVID-19 crisis and some of our key advocacy issues, we want to again encourage that federal funding for the PPE, the medical equipment, to protect those that are working on the front lines. And we also want to assist people with underlying chronic health conditions to ensure that they continue to have access to their medications and treatment. This includes removing some of those burdensome barriers that we talked about, including the limits on refills and advancing telehealth and remote patient monitoring. And then finally, we're working to ensure that we can conduct widespread testing and develop accurate reporting systems to truly understand the impact that COVID-19 is having on those underserved, disparate populations within the African American community, the Latino community, tribal communities, and other vulnerable populations. So at this point, it's my pleasure to introduce you to Dr. Alan Meadows. Dr. Meadows is the current president of the American College of Allergy, Asthma, and Immunology, and we're going to hear a word from him on the current state of allergy and asthma care.
Well, good day. Welcome from the American College of Allergy, Asthma, and Immunology to the first virtual version of Allergy and Asthma Day on Capitol Hill. I'm Alan Meadows. I'm president of the college, and I want to thank you for attending this. Just because things have changed and things are different, that doesn't mean that advocacy has changed or stopped or moved somewhere else. So thank you for being here. Your presence on Capitol Hill Day is so important to us all. So where are we now? Well, I'm reminded of what the patriot Thomas Paine said. These are the times that try men's souls. And it's difficult, but we still need to advocate for the rights of patients with allergy and asthma. We need to do it in a partnership between physicians and patients, and even pharmaceutical companies. A lot of people have said things that, you know, this is the way everybody should do things. But really, for doctors, for patients, there's really no one-size-fits-all solution. I think each individual needs to decide what they're going to do in their individual locality. I'm of the opinion that allergy and asthma services are essential. A lot of us have been in lockdown orders. Hopefully, we're coming out of lockdown orders. But I think that keeping people with allergies, asthma, life-threatening allergies out of the hospital frees up our hospitals and our emergency rooms to take care of people who are suffering from other things, because people are suffering needlessly from asthma and allergies, and that remains our goal even now. So just an update on kind of where we are. Asthma, 25 million Americans have asthma, 1 in 10 children, over 80 billion in annual coughs. And unfortunately, we still have over 3,000 deaths from asthma each year. Now, thankfully, because of the work of people like you and the Allergy and Asthma Network, we've seen that number decline, but even one death is too many. We're having 14.2 million people miss work a year, 13.8 miss school. Heartlessly, 3 in 5 limit their physical activities. And remember, the NILBH guidelines say that everyone with asthma should be normal. I don't consider missing work, school, or not being able to exercise normal. Almost 3/4 misuse their inhalers. And sadly, 1 in 5 Americans, even with the progress that we've made in making medicines available, 1 in 5 Americans still can't afford their medicines. And so that means that we as advocates still have a lot of work to do. Environmental allergies, 1 in 5 Americans have that. 4 million days of work deaths. Not quite as much money, $8 million, but look at this. Half of people say that allergies impact their daily quality of life. And this is something that runs in families. If you got one parent with allergies or asthma, it's a 50% chance those genes will be passed to your kids. And with 2 parents, 75% chance more likely. Environmental factors like pollen, mites, mold, pet dander are affecting things, and we get itchy, watery eyes, runny nose, sneezing. Really, the quality of life surveys that look at people with allergies, they're as bad as folks with asthma. And then we have life-threatening allergies. 1 in 12 children have been diagnosed with food allergies. We're looking at $24 billion in annual costs for food allergies. 29% of children with food allergies also have asthma, and 25% of food allergy reactions occur in students who never had a previous diagnosis. Wow, that's a big thing. And still, needlessly and sadly, 150 to 250 people a year die from food allergies. Now, stinging insect allergies, not as big a numbers as the other ones, but still 40 fatalities a year because of that. Where I'm from in Alabama, a lot of those are from fire ants. Needlessly, we have 400 people die a year because of drug allergies. And we still have a lot of people in the United States with latex allergy. So where do we go from here? Well, for those of you who know me, and I hope that there's some people here that do, you'll know I'm a big baseball fan. And Yogi Berra, the Hall of Famer from the New York Yankees, said a couple of quotes that I think are apropos for where we are now. If you don't know where you're going, you'll end up someplace else. And the future ain't what it used to be. Boy, what could be more true during this time when we're facing COVID-19? And I think COVID-19 will likely change the landscape of medical practices, including in allergies. We've already begun to see, for a variety of factors, consolidation into larger single specialty groups. And so the time of the mom and pop practice may be somewhat fading. I don't think it's going to go completely away, but I don't think all these changes are bad. I think that we can more efficiently deliver health care. So things are going to change, things are going to shift. We don't need to panic about that. But we still need to advocate for access to life-altering drugs as partners, as physicians, patients, the Allergy and Asthma Network, pharmaceutical industry. I know it's gotten kind of lost in the COVID-19 shuffle, but here in 2020, we have the first FDA-approved treatment for life-threatening food allergy. We're entering a new horizon. This is so exciting for us. And I know the drug that's available, I know there are criticisms of it, but we need to look at this as a first step. And so we'll learn from this in terms of dealing with our patients with food allergies, and we'll soon have better therapies. We've got novel targeted therapies for asthma. I've got many patients who are taking these biologic drugs. It's like they don't have asthma anymore. But these treatments are all very expensive. And there are a lot of factors out there that are trying to deny these treatments to our patients. And that's why it's so important that we as physicians, patients, advocate for access to these drugs. I'm reminded of history. I'm a little bit of a history buff as well, of the 1918 Spanish flu. People were saying things will never be the same. We'll never go back to normal. And you know what? After the 1918 Spanish flu, things never were the same. After a year and a half or so of recovery, they entered a period, a decade that was named after the decade, the Roaring 20s, because it was a time of unparalleled economic prosperity. And I don't want us to be negative. I want to encourage everyone to remain positive. You know, I know you're tired of this crisis and the compromises that we have to make. I am too. But remember, those of us who are here on this call, we're community leaders. And we often set the tone for our community. And I want to encourage you to remain positive. Certainly we don't want to spread the virus, but I want you to spread the contagion of a good attitude. And if you remain positive, then the people around you will remain positive, and we'll be able to achieve our mission of ending needless suffering. I don't know about you, but I don't want to end up someplace else. So thanks for attending the virtual version of Capitol Hill Day. I hope you find the rest of the programming enriching, as I certainly will. And we'll turn the program over to our host now. Thank you.
Thank you, Dr. Meadows. That was such an inspiring speech and certainly very helpful for us to understand not only where we have been, but where we are going in relation to allergy and asthma care. Next, I am excited to present and share with you actually a patient testimony from Emily Lentz. Emily lives and resides in Manhattan in New York City and has lived with severe asthma for much of her life. We're going to share her testimony and her experience of not only living with severe asthma, but also recovering from COVID-19. So thank you, Emily, in advance for your testimony and for sharing your story with us today.
is Emily Lenz, and I live in New York City. I've had asthma my whole life, with regular visits to the ER and some hospital stays until I was about 10. I'm also an allergy sufferer, both food and environmental. As an adult, I resumed my allergy shots and regularly see my doctor, Parikh, which is how I got connected to the Allergy and Asthma Network. I was dedicated to Advair for years, and anytime I tried to reduce my dose, my asthma would act up. I've now been on Xolair for 3.5 years, and it has been a big help for my asthma. Still, when I get a respiratory infection, I can count on the recovery being long and sometimes requiring steroids. Given my asthma history, my family and I were pretty concerned about how I would do if I were to get sick with COVID-19. In mid-March, I set up a plan with Dr. Parikh. I saw her for a dose of Xolair, and we decided to double the lower dose of Symbicort I had recently been taking. In addition, I continue to take Singulair and levocitrazine. With allergy season in full force in March, I was already not feeling 100%. My boyfriend, Leo, is a radiologist, and we knew he would continue to work once I started working from home. We set up our plan for minimizing my exposure while he continued to go to his clinic, taking the subway. None of that really mattered on March 20th when I settled in for my new life of working from home. I had a supply of prescriptions, Tylenol, and decongestants. I had felt prepared. But the next day, my boyfriend Leo felt sick. He didn't have a fever yet, just tired and a bit off. Overnight, he spiked a fever and had intense body aches. Suddenly, our plan for taking care of me shifted to taking care of him. For the next 3 days, Leo had a fever of 101.7 and couldn't get out of bed. He kept talking about the severe headache and back pain he felt, but there was no cough. The funny thing was he lost his sense of smell, even though he wasn't congested. Loss of smell hadn't been identified yet in the press as a common symptom, so we didn't think much of it. But, excuse me. By Tuesday, I was feeling crappy, just tired and a sore back, but no fever. I couldn't tell if it was being cooped up at home, fear of what might happen as New York became worse and worse, or something else. I'd take care of my boyfriend and then crash into bed at 8 p.m. My lungs had discomfort, but it was hard to distinguish it from allergies. We soon learned about loss of smell as a symptom of COVID-19, so we were pretty sure Leo had it. Neither of us wanted to take him to the hospital for testing, as his symptoms were unpleasant but manageable. As Leo got better, I started to feel worse. My back ached and my chest felt tight. The soreness around my ribs was something I associated with lots of coughing, but I still didn't have a cough. The next Saturday, a week after my boyfriend got sick, I lost my sense of smell. At this point, I was making each of us smell an empty bag of coffee every morning to see where we stood on smell. And this was the first time I couldn't smell it myself. The following week, my backaches were less, but the chest tightening got worse. I started taking my albuterol twice a day, whereas in the worst of allergy season, I might take it 3 times a week. It was a strain to talk during work calls. I looked at my calendar and saw I was due for my allergy shots. Still, even with the loss of smell, I was debating whether my discomfort was from allergies or COVID. I couldn't smell, but my nose wasn't stuffed up at all. I tried mentally preparing to go in for my allergy shots, as it was a terrifying time to be in New York. I didn't want to get sick if I wasn't already, and I didn't want to give it to anyone else if I was. Finally, I realized there was something I didn't need to decide on my own, and I called Dr. Parikh. Her response was absolutely not. You're not coming in. You are not leaving your apartment. We decided I'd check in after the weekend, and then we'd consider a dose of steroids, which is questionable whether or not it's a good thing to do during COVID. It wasn't until I got that confirmation from Dr. Parikh that it really sunk in I was likely sick with COVID-19. The following Saturday, I stuck my nose in the coffee bag and could smell again. By the evening, the persistent weight on my chest started to lift. By Tuesday, I was back to feeling pretty good. Once I got my energy back, it was clear that I'd been sick with something. It wasn't just a bout of asthma brought on by spring allergies. I feel very lucky that I was in a good position with my asthma when this pandemic came on. In a time when there were so many unknowns with COVID and lung disease sufferers, the plan Dr. Parikh and I made prior to my getting sick made me feel like I had some control and had done everything I could do to be in the best place possible. My boyfriend and I still haven't had an antibody test, despite volunteering for every study we've heard about. Hopefully, in the coming weeks, there will be enough confidence in the test that we will get it done. Right now, I feel I'm very fortunate to have experienced a mild case of COVID-19. But because we just don't know, I'm still maintaining my pre-COVID plan just in case. Thank you.
I'm sorry about that. Sorry. Had a little bit of technical difficulty there, but I think we're back. Thank you so much, Emily, for your inspiring story. I think that Emily absolutely demonstrates to us why it is so critically important to advocate. So to advocate not only for access to specialty care when your care plan is no longer working in primary care, but also access to treatment and access to testing. And it's through stories like Emily that really keep us motivated and encouraged to continue to publicly advocate on behalf of the more than 50 million Americans that are living with these conditions. In our next presentation, we're actually going to hear from Michelle Freemer. Michelle Freemer works and leads the efforts at the NHLBI, NIH's Institute for Heart, Lung, and Blood. And we're going to hear an update on the asthma guidelines, the National Asthma Education Expert Panel update. And so again, on behalf of NHLBI and Dr. Kiley, I welcome Michelle Freemer.
This is Michelle Freemer from the National Heart, Lung, and Blood Institute, presenting on behalf of the National Asthma Education and Prevention Program Coordinating Committee, or NAEPPCC. We are happy to provide an update on the 2020 focused update to the asthma management guidelines. As many of you may be aware, the National Asthma Education and Prevention Program, or NAEPP, was created in 1989 with the following goals: to raise awareness that asthma is a serious chronic condition, to ensure the signs and symptoms of asthma would be easily recognizable, to improve asthma control, and to reduce the burden to patients affected by asthma, increase their quality of life, and decrease the deaths from asthma. The NAEPP is supported by the National Heart, Lung, and Blood Institute of the National Institutes of Health. As one of its critical activities, the NAEPP published the first guidelines for diagnosing and managing asthma in 1991, and they completed the last update, which is known as the NAEPP Expert Panel Report 3, or EPR3, in 2007. In terms of the structure of the NAEPP itself, it did become a federal advisory committee, with the coordinating committee being the NAEPPCC in 2015. So in terms of what's happened since 2007, the last guidelines on the diagnosis and management of asthma, in 2014, NHLBI asked the public for information on whether or not EPR3 needed to be updated, and if so, which topics in EPR3 needed to be updated or what new topics needed to be added. On the basis of those the public's response, in 2015, the National Heart, Lung, and Blood Institute Advisory Committee Asthma Expert Working Group compiled those comments and then published what the 6 priority topics were on the basis of the public's input. The purpose of defining those topics was to then allow for systematic reviews, which are a search of the literature to find out what new information exists on these 6 topics in order to update the expert panel report 3. In addition, the Asthma Expert Working Group develops the key questions that needed to be answered for these 6 priority topics, And then NHLBI entered into a contract with the Agency for Healthcare Research and Quality to actually conduct the systematic reviews to answer the key questions on the 6 priority topics identified through the public request for information. AHRQ's evidence-based practice centers, which have expertise in performing these systematic reviews of the literature, published systematic reviews on the 6 priority topics between 2017 and 2018. And then, given we had the literature collected, the next step was to convene the expert panel. So the NAEPPCC convened the expert panel in 2018. And the first order of business was actually that the literature reviews were updated since the searches in the systematic reviews had been completed earlier. In 2019, the expert panel came up with a set of draft recommendations in response to the key questions on the 6 priority topics, and those were posted for public comment. And subsequently, revisions are being made, and in 2020, we have the anticipated publication of the final recommendations on these 6 topics from the expert panel. This slide demonstrates who the members of the expert panel are. They represent a broad range of expertise ranging from specialists and primary care providers, some pharmacologists, and so these are the members who are responsible for doing the work of coming up with the recommendations. Their work was focused on these topics, and the topics include the following. And again, this was based on the 2014 request for information. The first topic was the intermittent use of inhaled corticosteroids. Another was the use of long-acting muscarinic antagonists, or LAMAs, for asthma, bronchial thermoplasty, immunotherapy, which is allergy shots, indoor allergen reduction, or reducing exposure to allergens found indoors, and also the test, which is known as fractional exhaled nitric oxide, or FeNO. This slide provides a summary of what's actually encompassed in the 2020 focused update to the asthma management guidelines. As we just went over the topics, the focus is limited to those 6 topics. For the topics, a standardized approach was taken to assessing the evidence, and the expert panel did choose to use some diagrams to integrate the recommendations on the 6 topics into the totality of patient care. They also identified where there were gaps in knowledge about the 6 topics, and they provided advice on the implementation of their recommendations. What's not included in the focused update to the asthma guidelines are any other topics that might be found in EPR3, or any new topics that might have arisen since the 6 topics were selected, which, just as a reminder, was in 2014. So for example, any new treatments that were approved since 2014 would not be included in these focused updates. Also excluded would be any comprehensive approach to asthma management. As we just reviewed the 6 topics, that does not actually encompass the entire armamentarium that would be available to people caring for patients with asthma, and therefore the updates are, and the recommendations are just limited to those topics without being able to actually provide an update to the entire diagnosis and management of asthma. And another limitation would be the evidence, which actually just that's available within the literature. In terms of where we are now, to bring you up to speed, in 2018, as I mentioned, the NAEPP Coordinating Committee convened the expert panel, brought together that list of experts who you saw on a prior slide. The first order of business, once the expert panel was convened, was that they were provided with the systematic reviews, and those systematic reviews had to be updated with any new literature which had been published in the time since the systematic reviews had been completed. And with that, the expert panel began to review the evidence, and by December of 2019, the expert panel provided draft recommendations in a document that was posted for public comment. On the basis of those comments, revisions to the draft recommendations have been made by the expert panel, and the expert panel will be reviewing those revisions with the NAEPP Coordinating Committee as it oversees the expert panel. Once the NAEPP-CC approves the draft recommendations provided by the expert panel, the federal clearance process will begin, and publication will be following the clearance process. That was originally anticipated to be completed by the fall of 2020, but in the setting of the COVID-19 healthcare crisis, it's unclear how long the federal clearance process may be delayed, and therefore we just note that the publication will be subsequent to that process, however long it takes given the current circumstances. In order to be able to find updates on what is happening, because the NAEPP-CC oversees these updates, this is the webpage, which provides updates on the meetings as well as resources that are available from the NAEPP-CC. So this would be one source of information. In addition, another source of information would be the National Heart, Lung, and Blood Institute itself, with phone contact information provided for questions, as well as a website. And with that, this completes our update on the 2020 focused updates on asthma management, and we certainly appreciate the interest in this topic and the opportunity to present. Thank you.
Thank you, Michelle. We greatly appreciate that update from NHLBI and the work of the expert panel in addressing these 6 important topics. It also is important to note this is one of the additional reasons why we continue to advocate for NIH and for funding for federal programming. We know that it is these federal agencies and entities that help us to advance the understanding of the science and also to establish the standards of care that patients should expect. We are also very excited at Allergy and Asthma Network to announce that just this month, I, Tanya Winters, the president and CEO of the organization, have been elected to be the first patient advocate, patient reviewer on the global asthma guidelines, the GINA guidelines. This will be a term of service for the next 3 years, and these are the guidelines that are actually updated on an annual basis to look at the latest science and advancement in global standards in asthma care. And we are honored to serve in this capacity, in this role. Now I'd like to invite to the podium U.S. Representative Eliot Engel. Representative Engel has been proudly serving the Bronx in our Congress for a number of years, but also has been such a passionate leader of the Allergy Asthma Caucus for decades. We are so grateful to Representative Congressman Engel for his efforts in helping to continue to get Asthma Month recognized with a resolution, but also helping to advance policies throughout the Congress that are most meaningful to our patient population. So Representative Engel, we look forward to hearing from you.
As co-chair of the House Asthma and Allergy Caucus, I want to thank everyone for joining Allergy and Asthma's Network Virtual Advocacy Day on Capitol Hill. Together with my caucus co-chair Fred Upton and caucus members T.J. Cox and Pete King, we have introduced a bipartisan resolution making May as Asthma and Allergy Awareness Month to bring attention to the nearly 25 million Americans suffering from asthma and 50 million living with allergies. Our country is living in an unprecedented time as the COVID-19 pandemic is having a profound effect on the lives of millions of people around the world. Individuals living with allergies, asthma, COPD, and related lung health conditions are at a greater risk of developing serious complications as a result of COVID-19 and need to take additional steps to reduce the risk of infection. My colleagues and I are working tirelessly to address the many issues during this public health emergency, including increasing access to personal protective equipment, expanding testing for all Americans, and addressing health disparities related to the COVID-19 pandemic. Last month, the caucus sent a bipartisan letter signed by over 50 members of Congress to the U.S. Food and Drug Administration to address potential asthma drug shortages stemming from the COVID-19 pandemic. Our work as members of Congress does not end there as we look to bring greater relief to patients. The caucus has been at the forefront of pushing for increased funding for the CDC's National Asthma Control Program, which helps states monitor and treat asthma, and for the FDA to carry out vital work related to allergen labeling. As I said earlier, asthma and allergies take the greatest toll on our nation's most vulnerable population, including children. That is why we must protect and strengthen the programs that serve these populations, namely Medicaid and the Children's Health Insurance Program known as CHIP. Medicaid and CHIP cover more than 40% of American children. These programs serve as a lifeline for hardworking families who without them might not be able to afford health insurance. They are especially critical for children living with chronic conditions like asthma and allergies. In the 115th Congress, I helped secure a landmark 10-year reauthorization of the CHIP program as a member of the Energy and Committee Health Subcommittee. It is clear that more work is needed to lift the burdens created by asthma and allergies, and that's why I'm so heartened by your efforts today by sharing patient stories and boosting awareness of asthma and allergies. You're playing a key role in this effort. I promise to continue my efforts here in Congress to bring relief to patients and their loved ones back home, whether it be through federal funding, research, or increased awareness. I know that our combined efforts are helping Americans across the country lead healthier lives. Thank you again.
Thank you, Representative Engel. Again, as we come to the close of this 23rd Annual Allergy Asthma Day on Capitol Hill briefing, I want to take a moment to thank you. Thank you for your participation in today's event, but also thank you to our sponsors and to the staff of Allergy and Asthma Network, especially Charmaine Anderson, our Director of Advocacy, who continues to lead the efforts at Allergy and Asthma Network on advancing public policy. From Capitol Hill to local town halls, the network supports issues that improve care for more than 50 million people affected by allergies, asthma, and related conditions. It is our goal to raise visibility and to influence policy that improves care and promotes life-saving research. Through joining forces, through working together to raise awareness, we can ensure that allergies, asthma, and related conditions remain at the forefront and center of the national healthcare agenda. The network is eager to support you in your efforts to have your patient voice heard, not only on this Allergy Asthma Day on Capitol Hill through sending the letters, emails, and phone calls and social media posts that Charmaine outlined at the outset of our time together, but also by continuing to support these efforts throughout the upcoming year. Please mark your calendars and make plans to join us for Allergy Asthma Day on Capitol Hill 2021. We've already set that date. It will be May 5th of 2021, and we are looking forward to celebrating in person our 35th anniversary for the organization. We'll host our traditional Day on the Hill with our advocacy event with in-person visits to federal decision makers. And then we will host a gala celebration with a benefit concert by Little River Band. So in the meantime, remember, we're here to help. We're here to support you in your journey of living with allergy, asthma, and related conditions. Thank you once again for your participation in today's briefing.